Well, May is Skin Cancer Awareness Month, and today is Melanoma Monday.
It is a serious topic, folks, and board-certified dermatologist Dr. Sherry Ingraham is here with 5 ways we can all reduce our risk. Welcome back to the show.
Thank you for having me.
Okay, so this is serious business because when you look at the stats, a lot more people are affected by melanoma, and it is deadly.
It is deadly, but if caught early, it can be life-saving. You know, 1 in 5 Americans will develop skin cancer in their lifetime, but the wonderful thing is we can see it, we can spot it, and we can stop it. That's one thing that we need to talk about today, the 5 ways that we can reduce our chance of getting skin cancer.
Absolutely.
And part of that is, the first thing that we think of, I think, is sunscreen.
Right. Think of the S's. Think of shade, seek shade, bright times 10 to 4, and then look for sunscreen. You want a shot glass size. People don't realize they don't apply. Studies show they apply half the amount they need. You need a 1-ounce shot glass size put on
the body.
For the body. Now, every day before you leave your house, put SPF 30 on your face. That is the most important thing. You know, obviously brush your teeth, comb your hair, put your sunscreen on. If you're gonna go be in the water, you know, you wanna do it about 30 minutes before you go out to the beach. But the neat thing is there are products for everyone, every type of skin. There are sprays, there are powders, which we love. So I always say, put your cream on in the morning, but throughout the day for ease, reapply every 2 hours when you're out in the sun, and you can reapply with a spray or a powder.
And this powder is so fantastic. You showed us this before, but men and women can use this product.
Absolutely. Men love this powder. You keep it in your pocket, you're out on a boat, you just reapply it, it stays on beautifully, it matches your skin, it doesn't really give you a color, or it can give you coverage if you want.
Or out on the golf course as well.
I think they're all great products. These are all great things to just touch up to for your makeup, right?
Absolutely.
Okay.
Double duty, double duty.
SPF 30 is minimum on your
SPF
face.
30 is minimum. You always want to do a 30. Anything less is just not effective. But remember, we don't apply enough. So the higher the SPF, the better, because that makes up that gap because we don't put enough on.
What about, we're now seeing the 90s and the 100s.
Right.
Is that effective too?
Yes. So what I tell people is you don't need to buy 100. You can buy a 30 and put on a good, nice coating. But if you're one of those people who doesn't apply enough, you may want to buy the 100 because you don't have to be perhaps as religious about it. Now for men, I love sun shirts and I love supplements. HelioCare is a wonderful vitamin. It's a Honduran fern leaf extract, polypodium leucotomos, and studies show it's a very powerful anti-aging antioxidant, but it actually helps our skin fight UV damage. So a lot of my male patients, my golfers, my tennis players, my boaters, my hunters, they love taking this pill every day. I say take one every day. If you're gonna be out in the sun a little longer, perhaps on vacation, take 2 a day. Men love these sunscreen deodorant sticks too, and we're gonna display that on our model in a moment. So speaking of models, what we're gonna talk about are sunscreen clothes. So I'm going to show you on our models what we typically do. So Jennifer, our first model, is wearing one of my favorite products. These are Coolabar sleeves and gloves. You can get these online from Coolabar. They are fantastic. You know, you're a mom, your kids are in a soccer or a softball game, it's hot outside, you just pull these up, you're driving in your car, you don't want brown spots on your hands. Keep these in the glove compartment. That is a favorite trick of dermatologists.
Awesome.
And then a good broad-rimmed hat. So we love these for women. For daughters, for sons, you want to wear a sun shirt. Start them young. That is the most important thing. So Eden here, our model, is wearing a wonderful bathing suit from J. Crew, and it's her favorite bathing suit because she doesn't have to reapply sunscreen. You don't have to chase her around. But what Eden likes to do is put her own sunscreen on, and I recommend these deodorant sticks from Neutrogena all the time. And she's got one there. I have one here. Men love these things. I tell them, keep it in your bag, and reapply it during the day.
And super easy for them to do it.
Kids do it themselves.
What's the smell like?
Not bad at all.
Not bad at all.
And a little trick on your hands, if you're prone to brown spots, put it on your hands in the morning. It's tough to wash off when you're driving. If you don't have the gloves, it's great. For other individuals, I say keep a hat in your car. So many sunscreens I catch on the scalp, especially if you're blonde or you're starting to thin. Wear a good hat. Now, if you're a man and you have short hair, you want a hat with flaps in the back, okay? These are great as well. The best thing you can do is just think about covering up. For babies, 6 months and under, you can't use sunscreen. So you've got to keep them covered in the shade. After 6 months, they can wear sunscreen. But for us, reapplying every 2 hours doesn't always work. So taking the HelioCare can take the edge off. It builds up in your system, gives you protection. Wearing some protective clothing, you're stacking the odds in your favor.
What about the ears? Because this is an area that's exposed. I know, Jennifer, you had on this wide-brimmed hat.
Right.
But this, Dr. Ingraham, is an area that especially men are vulnerable.
So true. I find more skin cancers in men's temples and their ears and the backs of their necks. So what you want to do, of course, is go to a board-certified dermatologist once a year, get a full-body exam, and let us look through your scalp. Have your hairdresser look. Look for the 5 important things, you know, the A, B, C's, D's, and E's. You look for asymmetry. Look for border changes, look for color changes, diameter changes, and the evolution of a lesion. These are all hints that something can be transitioning to a skin cancer. And do a skin self-exam on yourself or have a loved one. I always say wives save lives, but husbands do too. So you want to look for spots on yourself. You know, get a chair, get a mirror, and look in places you don't normally see. Have your boyfriend, your partner look at you in places you can't see yourself. And then once a year, go to the dermatologist. But what you were mentioning is really important. Today I saw a patient actually on the back of the neck, and I told him, you're doing such a good job putting sunscreen on the back of your neck, because most men forget, and that's why those hats with the flaps are great, and the ears is a really big issue. So baseball caps are great, but if you can wear a broad rim hat when you're out really, you know, on a boat or golfing, you're going to get better protection.
Yeah. And again, when you are doing that body check, you are looking for the color, you're looking for the shape. Those are kind of the two.
Right. It's the A, the asymmetry, the border is really the border being related. The C is the color. Variations in color. You don't want variations in color. Diameter. You don't want it enlarging in evolution. Like you said, if you said, you know, I had this one small little brown spot and it started to enlarge and change.
Looking different. Yeah.
Anything that just you don't feel like it used to look. And remember, skin cancer can develop in new lesions, de novo, but it can also develop in a birthmark or something you've had for years that suddenly changes. That's the E for evolution. Get it checked.
And between the toes and bottom of the feet, by the way, right?
Absolutely. I mean, we find things on ears. I found them inside the nose and often on the bottom of the feet. So really, places you don't think the sun shines do get skin cancer, especially melanoma.
And always great information. Dr. Ingraham, she's going to stick around after the break. We are talking vitamin C and the benefits of adding it to our daily routine.
Thanks to our lovely models, Eden and Jennifer. I love that swimsuit, by the way.